Hi, my name is Dr. Marja. I am going to be your doctor today. Now, I see that you are here for a yearly checkup. Is that correct? Okay, great. Awesome. All right, well, we're going to sit here for just a second, and I'm going to kind of go over some paperwork with you, okay? Now, most of the questions that I'm going to ask you did fill out in your intake paperwork, but I just want to confirm them, and then there's a couple of questions that I would like to ask in addition to your intake paperwork. So, alright, so the first thing that I want to go over with you is I just want to get some general information. So, what is your name? Date of birth? Okay. Address? Okay. Phone number? And is that a cell phone or a home phone? Okay, perfect. Okay. Now I do show that they did get your weight out there. Okay. Alright. And have you had any recent changes in your weight? Up, down, anything? Okay, perfect. And how tall are you? Wonderful. Okay. Now, I do have an emergency contact. Phone number ends in 9262. Is that correct? Okay. And what is their relationship to you? Okay, thank you. And are you employed? Is that full-time? Okay. And what's your occupation? Okay. Now, do you know of any hazards, liquid, gas, anything like that, that would cause you to have any adverse effects? No? Okay. Wonderful. And about how many hours a night do you sleep? Okay. Alright. Do you feel rested when you wake? Okay. Smoke? Drink? And about how many drinks per week? Perfect. Do you have any allergies? And this could be anything topical that touches the skin, dyes, perfumes, medications, anything like that. Okay. And what reaction do you have to that? Oh, that's not bad. Okay. That's just a little irritating. Okay, well that's good. That's good that it's not worse. Okay. And what medications are you taking? And milligram? 20? And do you take that one time a day? Night or morning? Okay. And anything else? Okay. And the milligram on that? Okay, 15. And is that once or twice a day? Both morning and night. Okay, perfect. Any surgeries? Okay, and when did you have that appendectomy? Okay, anything else? Wisdom teeth? Okay. You're 25, so, okay, perfect. Alright, so when you did your paperwork, you did put down all of your history as far as illnesses or things that you've experienced. We do need to go over any kind of immediate family history. This would be things, people such as grandparents, aunts, uncles, parents, nieces, nephews, brothers, sisters, anything like that. So any immediate family. Okay, so any history of cancer or tumors? Okay, good. And any autoimmune issues? RA, lupus, fibromyalgia, those would be some examples. Okay, alright, that's good. And any heart disease or stroke? Okay. Any heart attacks? Okay. Good. Sounds like you've had a very healthy family. That's awesome. And do you take any vitamins or supplements daily? Okay. And can I ask why you took why you take the one? Okay. Alright. The reason that I ask is that we do test for that level in your body. It's one of the tests in the blood work that we do. So that is good that we know about that you do take that every day. So if there is a deficiency, then we know that we need to adjust some things or figure out why you still have a deficiency in it. So yeah, that's usually why people end up taking that one. Okay. And alright, so first thing that I'm going to go ahead and do is I am going to take just some kind of general things. I'm going to do your temperature, blood pressure, heart rate, listen to your heart and lungs, just some general stuff, and then we are going to do 2 exams. I'm going to kind of do a cranial nerve exam. Oh, don't be scared. It's not, it's scary. It's scarier sounding than it is. Basically, a cranial nerve exam is just an examination of the nerves in your face and head. That's it. Nothing scary. Basically just touching areas on your face, and that's it. Nothing bad. And then I'll just be doing some general touching of your shoulders, your neck, your throat, checking your mouth, your ears, things like that. So nothing major. Okay. All right. Well, let's go ahead and get started. And I will be making notes throughout the process as well. Okay. All right. So the first thing that I want to do is need to put on some gloves. Okay, so let me just a second. And these are non-latex vinyl gloves. I know that you didn't mention a latex allergy, but I do like to mention that. Sometimes people forget to tell us. Plus, we do have a lot of patients that do have that allergy. Okay, so the temperature is very, very easy. All it does is go over your forehead. So I'll go ahead and do that. Perfect, thank you. All right. Let me grab your wrist, take your pulse real quick. Okay, perfect, thank you. All right. We'll be doing your blood pressure now. This is on a manual blood pressure cuff. We do prefer a manual blood pressure cuff in this office, so just because they do tend to be a little bit more accurate. Just slide this on your arm. Perfect. Okay, just put that on. Alright, so the first thing that I'm going to be doing during our cranial nerve exam is that I will be testing the reflexes in your pupils. Okay, so I'm going to put a hand right here between your nose, or between your eyes, on your nose, and just shining a light into it. The light is very bright, so it's perfectly fine. You do not have to look directly into the light. If you want to look at my nose or the wall back there, that's perfectly fine. You don't have to look directly into it for the reaction to be noted. Okay? Okay. Perfect. Thank you. Okay. Okay. The next thing that I'm going to do is just test the strength of your muscles in your eye. So I'm going to have you close your eyes really, really tight, and then just don't let me open them, okay? Okay. Perfect. Good job. Okay. All right. Now, for this test, I'm going to have to put my hand on your chin, so don't be alarmed. The reason that I do that is that I am going to have you follow my finger, and for you to follow my finger, I want you to just do it with your eyes, not your head. And sometimes people don't realize that they're moving their head when they're doing that. So I just put my hand on there just to remind you not to move your head. Just follow my finger with your eyes. Okay, perfect. Good job. All right. Okay, perfect. And when I was doing that, or having you do that, was there any soreness or tension felt in your eyes? Did you have any changes of vision? Good. Okay. Perfect. All right. Now, so I do need to press on your face for the next few tests. The first one that I'm going to be doing is just a test of your sensation on your face to see if it's equal, okay? So I'm going to start at the top and then touch various places on your face, okay? All right. Okay. On your forehead first. Do you feel that? And is it equal? Perfect. On your temples? Equal? Perfect. And on your cheeks, underneath your eyes. Perfect. And your cheeks down closer to your jaw. And your chin. Perfect. All right. And were all of those equal? Equal pressure? Perfect. Okay. All right. So the next thing that I'm going to have you do is we're going to test the muscles in your jaw and up here. So I'm going to need you to clench your jaw for me when I tell you to, and then relax when I tell you to, okay? All right. Go ahead and clench your jaw and relax. Clench your jaw and relax. Okay, perfect. All right, the last thing that we're going to do for this exam is that I am going to need you to, I'm going to touch about here, and I'm going to need you to go like that for me, okay? Okay, all right. Okay, all right, so I did note a little bit of a pop on this side, so on your right side. Now, when you do that, is that only happening when you put your jaw to the side? Had you ever had that before? You have? Okay. Does it happen when you're eating, talking, eating? Okay. Does it ever cause any pain in your ear, fullness, any pain in your jaw that radiates or anything like that? Do you ever notice a headache when it's doing it? Does your jaw ever lock? Okay. That's good. That's good. No. Oh, it's nothing to worry about. It does happen quite often. What we do in those cases is we do assess the severity. In your case, the popping is not negatively affecting you at this point. We do want you to keep an eye on it. If you notice that it is getting worse, because it can ease up over time too. Normally it just means there's a little inflammation there, but if you notice it happening over time and getting worse, or other symptoms arise, like I noted, please let us know as soon as possible, okay? I'm just going to go ahead and put that in your chart, all right? Okay, perfect. All right. Well, we are just about done, so that's great. You have done fantastic. The next few things I'm going to do are just kind of more regular routine things that you're probably used to. Just feeling of your neck, having you swallow for me, feeling around the muscles in your chest right here, and then doing some listening to your lungs and stuff like that. So nothing too bad. All right. Okay. Go ahead and get my stethoscope. I guess I should put it on. All right. Now, I'm going to have you breathe in and out for me, okay? Breathe in. Breathe out. Breathe in. Breathe out. In. Out. In and out. Perfect. Okay, I am going to listen to your heart, so just breathe normally for me, okay? Perfect. Very strong, very strong. Thank you. Okay, so What I'm going to have you do now is I just want you to kind of relax. I'm going to feel your neck and around here, okay? Just feeling I'm feeling those lymph nodes, so nothing scary. Okay. Okay, all right, now I'm going to touch your throat, kind of press a little bit, and I want you to swallow for me, okay? I'm going to tell you to. Okay, swallow. Okay, swallow. Okay, perfect. Now, did you have any difficulty swallowing when I had you do that? No? Okay, that's very good. Very, very good. Everything felt good. Okay, so I did not note anything of concern other than that popping, and honestly I think that that's just a little bit of inflammation, you know, different things like that, eating, you know, chewing gum or eating lots of chewy foods, things like that, taffy, even some meats, it can cause that. Basically just kind of keep an eye on it. If it happens a lot, or if you notice that it's not getting better, or you see other symptoms, definitely check with us. But I don't think it's anything to be concerned of. So what we're going to do next is I am going to have you head on over to our laboratory. I do have some paperwork that I will have to send over with you. Okay, let me get that really quick. Okay, so here is the paperwork that I'm going to need to take over to the lab. Okay, it's basically just letting them know what needs to be done, all of that. Okay, so you will just take this over to them. They'll do your blood work. They're very, very gentle, I promise. They're very, very sweet. All you'll need to do is just head out this door right here, and you'll take a left and go all the way to the end of the hallway, and there is a sign that says lab. Okay, just give this paperwork to the lady at the desk and she will get you all checked in. Thank you, and I hope you have a wonderful day. Thanks so much for coming to our clinic.